quality comes from understanding the disease process, improving techniques and skills, keeping up with the most current research out there, and taking it a step more further and actually performing your own research, changing your procedures, improving them on a daily basis, thinking about how can you make things better. And with that, you maintain quality. Another thing is, the importance of keeping up with your data, logging in all your, issues if there is any, keeping up with the national data bank, bringing all the results. We have quarterly meetings, for example, where we discuss our results, how do we compare to the country, how do we compare to the rest of the world in some instances. And there are other independent organizations that can actually grade us. And with that, we've always tried to achieve the highest level of grading, the highest level of success with these independent organizations.
I think quality starts from the minute we first see patients, from the minute they walk into our office, all the way till through after their surgery. I think that individualizing plans for patients, seeing how this medical condition may impact their risk of having a complication, and addressing that early on to minimize those risks, and just working as a team to give each patient the best outcome possible. And every step of the way, we have to reevaluate and reassess each patient and decide what is the safest option, what is the best option, how can we minimize this individual patient's risk of having any complication. And if we look at each patient like that, I think we can maintain the highest level of quality.
And sometimes those plans may change. We may sit down at our initial consultation and come up with what we think is an ideal treatment, and as you go through your workup, you're meeting cardiologists, pulmonologists, we're doing an endoscopy to take a look at the anatomy of the stomach, and it may cause us to shift paradigm a little bit and maybe go towards a different procedure where you would do better with. So quality, like you touched on, comes from really evaluating everything. Data is so important, because without data, we can't tell how well we're doing and what changes we can make to improve it. And it's a team approach.
Most definitely. I mean, collaboration throughout the entire process with our gastroenterology colleagues, cardiology, pulmonology specialists, and most importantly, the patient. If during the pre-op testing we find that a procedure isn't appropriate, you have to switch gears. And intraoperatively, we are all pretty good surgeons, but in the OR, there's at least 2, sometimes 3 surgeons scrubbed in with one person, with one patient, and I think there's a synergy to that. And that's something that I particularly enjoy.
I think there's also a patient participation factor as well. As patients come in and they see that we're tailoring the treatment to them and their specific comorbidities and how this is going to help them, they then understand that this is a treatment for them, so that we're not just doing something to them. We're doing the surgery for them and to help them get better. So for them to be able to get up and walk right away, and to take in their liquid diet, and to get back on their normal activity level and back to their normal baseline, basically, they understand that will actually help them get better faster.
And I think our patients know what to expect. So they know how hard they have to work. Because what bothers me the most is some people say that surgery is the easy way out. And it's about far from the truth as you can get. Because our patients work extremely hard to get to where they are on surgery day, and work even harder to get through those first few months to get back into their new life. So it's like Laura said, it's patient driven, but they feel the love from us, and they have that desire to get better, and it pushes them to succeed. And I think that contributes also to their success and our happiness as surgeons.
Our practice is in the top 10, if not top 5% in the country in volume and in quality and in metrics about safety, and that's not an accident. That happens through teamwork amongst our team, surgically and clinically behind the scenes with our staff and in the hospital, but it also comes from our patients, like Dr. Melman said. This is a team approach, and patients have to be a part of that care team. And then when you're part of that treatment strategy and that algorithm as a team, every person along the pathway, from the intake staff at the front desk, from the nurses in the hospital to the recovery area, the surgeons themselves in our group. Everyone is invested in success and look at their part and their role in this team as vital to each patient's success. And it's an enormous team. It's not just the group sitting in front of the camera here today. It's the dozens of people behind the scenes who all are vested in the success of our patients in our practice and our program. And when you have everyone who's taking a responsibility for their role and looking and being highly critical of their own role and what they can do better in this process, you see that the quality shows. And when everybody's invested in success happens. We are also fortunate to have such a high volume of patients because of our history of quality that we can see very rapidly as we make changes to our algorithms how much better things can get. And many places don't have that benefit.
It's not just the surgery alone, though. I mean, talking about quality metrics, fine, we do a very safe procedure. Our length of stay is relatively short, but it's also what they do with the procedure afterwards. So bariatrics is a tool. And we have a lot of support networks in place, whether it's support groups, monthly support groups in person or through online resources. But there's lots of different sessions, education sessions, nutritionists, and we always encourage follow-up, especially not only with us, but also with the nutritionists and the support structures in place.